going to go through some thoughts about learning that we've been doing during COVID. This is a bit of an experiment because each time I think about what we're learning, it comes out in so many different ways. As Joseph just said in our conversation just now, it sure is complex, and it's trying to make sense of that complexity that's been very much with me actually now for several weeks. And I'm now going to try, and it's thanks to the team that I'm about to do what I'm going to do to share with you some of what I'm learning. And I would like to add it and say what I think we're all learning as we're going through this. And just remember, we're only a bit of way into COVID. It's not towards the end. Whilst some parts of the world are getting on top of the peak of the early outbreak, this virus is here to stay. And we're going to have to learn to live with it and to have fun with it and to earn money and run our lives despite the threat of COVID. So this is something that learning matters. Now, I think the first thing I want to do is to say that it's worth distinguishing what we're learning about the virus, what we're learning about people, what we're learning happening in different places, and then also the way in which we're all collectively making sense of what is happening. And that fourth part, the making sense part, is the most difficult part for me, because I'm actually trying to form an integration of what I'm picking up from lots of different communities around the world. And I've still got a few untested propositions in there. I'm saying that because this is a new virus, 5 months old, as best I know, perhaps it's been around for longer, but we've been studying it all for 5 months. We really do have to start from thinking about science and evidence. And what is science? Science is the process of testing hypotheses and seeing whether or not you can disprove them. Basically, you have propositions, you examine them, and if they don't turn out to be right when you examine them, you adapt the propositions. And so the science that's working with us on coronavirus really is an evolving science. We're learning about the virus all the time, and there are many things, as I've said before, we don't know, and there are probably many things that we don't know, and we don't know them. So you can see that there are lots and lots of unknowns that we're going to have to deal with. And there is an absolute premium on good quality observational science, good quality experimental science, and good quality documentation just of how things are evolving. So I'm giving a very high priority in my own learning to the value of good quality science that critically examines hypotheses and tests them. And if a hypothesis does turn out to be wrong and you have to readjust, that's a good thing and not a bad thing. It's that capacity to evolve our understanding that's going to be so important. I'm also noting that there are a number of common principles emerging about how the virus behaves and how we can best respond to it. But those common principles also are evolving as well. But in summary, the core principle is that we try to interrupt transmission of this virus by finding people with the disease, ensuring they're isolated, and then tracing their contacts and making sure they're isolated too, and protecting those who are most vulnerable, whilst at the same time constantly reinforcing and strengthening public health services and hospitals. And this is a challenge. So, because in places that don't have strong health systems, there are difficulties with keeping the hospitals strong. There are difficulties with the basic public health service. But the common principles don't differ from country to country. It's just that they're adapted to the reality in different circumstances. What happens in the UK will be different from what happens in the Philippines, what happens in Nepal. But I want to be very clear that when it comes to this virus, there is one core approach that has to be used everywhere, the one of interrupting transmission. It helps hugely if you've got a test to know whether or not you've got the virus. But even if you haven't, you do your best. For example, a colleague of mine called Richard Horton from the Lancet's just been saying, one of the things we need to do is to help people know when they got COVID. And one of the first signs for many people is a loss of a sense of smell. And so Richard is saying, perhaps we need to be much more clear with everybody that if you lose your sense of smell suddenly, that's a sign to isolate yourself, because that means you're at the early stage of your COVID and you're probably really infectious at that time. So the common principle of being able to isolate yourself as soon as you have any sign of the disease, and to make sure contacts are isolated as well, that is not changing anywhere. And I think it's important that we hold on to that. The third thing about the virus is how ferocious it is. It really is easily transmitted. And so what really matters is that we are fast and that we are robust when we find the virus is in a community. I know that people are saying, well, that's really difficult. You just don't know where the virus is. But I'm saying, if you know virus is being transmitted in your community, you have to be really on the alert and you have to respond quickly, because we've got so many lessons that we're learning, keep coming back to that word, from around the world, that if you go slow and if you wait and if you try to do various what they call proportionate responses, you'll get caught and there'll be a lot of disease and a lot of people will suffer and die. And dealing with the problem will be so much harder if you're slow. So fast and robust if you possibly can be. I know that for some of you, this is a bit difficult because you're saying, we just don't have the tools that we need to do it. We don't have the testing. And I appreciate that that's hard, but being fast and robust, even when there are only a few cases, is really, really important. And then the fourth thing on the virus is that we can stop it being transmitted. We can stop it being transmitted through physical distancing, and we can stop it being transmitted through reducing the likelihood that droplets pass far in front of our mouths, so that when we cough into our elbow, and yes, we protect our faces. There's not a lot of difference between coughing into your elbow and wearing a cloth face protector. It's the same basic thing. You're trying to stop the respiratory particles from traveling. So yes, we can do a lot ourselves to protect others, especially if we've got early COVID, physical distancing, and at the same time, face protection. And although there's an awful lot of argument and debate about face protection, I'm absolutely clear that that's part of the comprehensive way in which we protect against this virus, because this virus really likes to travel between people and it does it through respiratory droplets. So these are four bits of learning that I think relate to the virus. Firstly, that we're having to go on doing the science and test. Secondly, that there are some common principles for response. Third, that fast and robust action is absolutely key. If you wait, if you're slow, the virus will go everywhere. And fourth, that there are opportunities for protecting ourselves and others through physical distancing and through face protection. Hidden in this about the virus, and I'm just adding this as a footnote, is we do still have some questions about immunity. If I get COVID, am I immune to reinfection? Not really clear yet. I mean, I hope so. And I hope it'll be a lifelong immunity. But I think it's important not to assume that everybody who has COVID will be immune. Probably useful to assume that immunity varies, perhaps with age, or perhaps with sex, or perhaps with ethnicity. We shall see. So hidden in this stuff about the virus is this footnote of always be ready for more surprises. Again, several of you have said to me, both on these calls and in personal interaction, that you're constantly surprised about what this virus is telling you. And I think that's okay. I think we should say to each other, we're learning, we're getting surprised. Sometimes we wonder whether the virus is changing behavior. And here are the sort of questions that I'm getting about the virus. Why is it apparently so easy for people who work in meat packing plants to get this virus? We've got reports that in the places where they actually cut up animals and create the sort of packages of meat that then go to grocery stores or to restaurants, that actually an awful lot of their workers are getting COVID, enormous numbers, and dying. And it's in the US, it's in Poland, it's in Ireland, it's in it's in Australia. What is it? And it's the sort of thing where you've got a surprise. What's going on? A friend of mine who works for the trades union that actually has all the meat packers within its numbers, he said, is there something going on in these places where humans are in close contact with the flesh of recently killed animals that actually makes them more susceptible to infection? So that's one of surprises, questions. And I think that all of us need to be really comfortable with that reality. This virus is giving us all sorts of surprises. We don't have the answers, and it's best not to behave as though we do, because again, then we'll be caught out. So the virus is also teaching us the reality that when you're working in science, you have to have constant humility. You don't know the answers. People ask you for the answers, but so often you have to say, well, I'm not sure. And that's okay. So those were my 4 things about the virus. Then my second sort of areas of learning was thinking about people. The virus does not exist except inside the body of a person. This is a sort of truth. Okay, so people will say, well, can't the virus last for a few hours on a surface? I say, yes, but it's dying on that surface. To live, it needs to be inside the body of a person. A virus is simply just a tiny, tiny bit of what we call RNA in this case, which is the capacity of a thing to reproduce itself. But it can't reproduce itself without being inside a human cell. So it needs people. This virus is a parasite. I mean, I want to be careful here because parasite refers to a particular class of pathogen. But in its existence, this virus colonizes us. And it reproduces. And in reproducing, it damages our cells because it breaks them up. And that's what makes us stupid ill. And that's all this virus is doing, is just reproducing, 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 and then hopping from person to person to person super easily. So people matter when we're talking about this virus. And so I'm going to start with that when it comes to people, who we are matters. And perhaps I want to go further and say our culture matters, because different groups of people respond differently to the advice that is given about living with this virus. I said to you that there are common principles for responding, but the way in which those principles are applied and then the way in which people respond when they are asked to act, that varies hugely. I'm asked often about Johan Giesecke, who is an amazing epidemiologist in Sweden, who has said very clearly that he is going to provide the advice to the government. And because he is an independent scientist running a national institution that has a legal status in Sweden, actually his advice is taken very seriously by government. And if, for example, the politicians don't agree, they have to be very clear to Swedish parliamentarians why it is they're not following the advice of the head of the Public Health Institute in Sweden. So this is Dr. Giesecke. And Dr. Giesecke says, actually in Sweden, people will physically distance. We don't have to create some kind of legal sanction for them to do so, because they're used to working within a social contract between citizens and government that actually has a mutual respect both sides. So if government says, keep your distance, then people do. Of course, not everybody, we're here talking about the norm, but culture really does matter, because if people in Sweden are able to maintain physical distancing, are able to be really responsible about what they do when they cough, are able to be incredibly responsible about isolating when they've got symptoms of COVID. And of course, it makes sense for the government to say, okay, we'll go with the people. We'll test it out. We'll see. But what an interesting thing to do, because of course, other countries, there's had to be strong sanctions, sometimes very strong sanctions, fines. People get even finding that they can't stay in their jobs because they're not holding on to the instruction from government. So yeah, culture really matters. Then secondly, on people, this virus doesn't affect us all the same. It seems that those who are in roles where they're serving others also seem to be those who are most likely to suffer. And I've talked about this before, but I think you have to go on saying it. Health and care professionals, but also people who are driving public transport, people who are cashiers in grocery stores, or people who are providing personal services who have to be close to others, including those who are working in providing music and entertainment, and they are close to people, they are at risk, or people who are organizing religious services. They're just those who serve are at risk because their service brings them close to others. And some of them interact with a lot who are ill. So we've got to be clear that those who are providing service are in danger. And I just want to be clear, I've said it again before, but I hope you don't mind me repeating things. The people who are in these service roles are mostly women, and they're almost always very low paid. So those who serve suffer and are not paid adequately. And that combination is really important. The third point about people is that when it comes to trying to contain this virus, there are huge inequalities, and those get exacerbated by the containment measures. So we've seen very clearly that all over the world, it is the low paid people in the informal sector who are most likely to suffer as a result of the containment approach. And that really means that we have to pay attention to that. And as a society, we have to be able to respond to that. And we have to be very clear that if you're trying to contain a disease like this, your poorer people are suffering terribly, and you've got to respond to that. You can't just say, oh, well, bad luck. Rich are fine, or people just have to put up with it. No. And so recognizing the inequalities is absolutely huge. Fourthly, there is resourcefulness everywhere in way of responding to this. And we're seeing this so widely. Whether it's in Ethiopia, we're seeing people really adapt the whole cell phone system so that you can use it as a way of alerting, using special ringtones to send messages, or whether we've seen it again in other African countries, the speed with which they've been able to create extraordinary capacity for looking after people who are sick, or many places where homemade masks are being tailored quickly, factories are being repurposed. This resourcefulness is absolutely key. Now, those are my 4 quick things about I'm learning about people. Who we are matters in terms of our culture. Secondly, those who serve suffer and are often not well paid. Thirdly, there are inequities and inequalities that are existing in society, but those increase as a result of COVID and containment measures. And fourthly, we're seeing extraordinary capacity for resourcefulness. Just briefly on place, I actually really want to stress that this is something that we must always remember does manifest differently in different environments. Here within France, there are huge variations in patterns of infection, and they're partly related to how people move, and they're partly related to how people gather and live. And just, I want to stress that this notion that it's all the same everywhere, no, it varies hugely from location to location, and we have to take that into our account. Now I want to go to the last part of what I'm learning, and that is what's happening as we all collectively make sense of this. I don't want to be melodramatic, but quite simply, there are 7.8 billion people on this planet. And I reckon all 7.8 billion people in different ways are having to make sense of what is happening. Some not quite understanding at all, not able to make any sense of it at all. Others putting a huge amount of time and effort into making sense of it. And you know, it was just yesterday talking with Florence, I realized that one of the real consequences of this widespread lockdown affecting many more than half the people in our world is that it has forced all of us to be thinking, what on earth is going on to have this extraordinary impact on everyone? So it's the first point to say on sense making is it's a simultaneous process underway everywhere. And it's both disturbing and at the same time, in a funny way for some, quite inspiring, because there are all sorts of new possibilities that come through it. Second thing that I'm learning, and I've said it a bit beforehand, but I really want to stress this. We have never been so connected as we are now. And our solidarity through those connections matters enormously. I'm never quite sure how best to describe this, but it's a bit like the metaphor of a chain, and we're only as strong as the weakest link in the chain. We're only safe if everyone is safe. And if we are seeing ourselves as free individuals in society, we have to also recognize that with that freedom comes responsibility. If we're not responsible, if we're selfish, there really are risks for all. So stressing that solidarity really matters. Thirdly, building on what I said about resourcefulness, there are some properties of humanity that I think are coming out more and more strongly, and they come out by the week. And the most important is that humanity is ingenious. I mean, I want to go further than that and say, not only is humanity ingenious, but we're starting to see the extraordinary potential of humanity as we work through this particular challenge to all of us. I mean, we've got an extraordinary, you need a phenomenal capacity to advance the way in which we design responses and apply science, even with very limited resources. Our combination of creativity and ingenuity and our ability to learn incredibly rapidly from each other seem to be characteristics that are coming out more and more. It's as though we're starting to really appreciate the extraordinary potential of this human creature that we are, that actually, if we work together, we can achieve extraordinary results because humanity is so ingenious. That doesn't mean it's all plain sailing. I think we learn, again through this crisis, that there are multiple difficult choices that have to be made. Are we going to prioritize equity, or are we going to just put emphasis on our own survival? Are we going to concentrate on redressing some of the inequities that are exposed by COVID, or are we just going to paper over them? Every government, everywhere, is having to make choices. And some of them are really stark. Do we bail out a business, or do we give more money so that poor people can get food they need? And of course, it's never either or. Ideally, it's both and. And I think that just continuing to look at some of those difficult choices through the lens of humanity, through the lens of equity, through the lens of sustainability is important. So I think we're developing new frames for our choices and not simply going back to the usual stuff. So a business is in difficulty, sack the staff. No, I'm talking to business leaders more and more now, saying we're going to do everything we can not to have to lose our staff, because our staff are our family. So new frames for our choices, I think, is one of the things that I'm getting out of that. And that links me to the related point I was just saying, that business has an important role in helping us through this. We should not assume that this is just done by government, and civil society and professionals and institutions. Business is an extraordinary fabric, whether it's entrepreneurs, small and medium enterprises, or larger businesses. And I'm quite enjoying working with businesses and watching them feel their way through this and really see if they can reinvent their understanding of what a good business is. And now I come to my last point before we go into the Q&A. Sorry for the longer session than usual, but we spent a bit of time thinking about this one and I'm trying to get it right. But this is the key part. If I'm right, that as well as learning about the virus, as well as learning about how people react to the virus, as well as learning about how it depends on place, we're also learning an awful lot through how we make sense of this. And that we're finding that there's so much potential of humanity through ingenuity to just do stuff better. I find myself asking a question, well then, what do we expect of our leaders? And I don't mean the leaders who are bosses. I mean of leaders anywhere. I've just got two little mottos that I want to share with you as I finish. The first is a basic statement about the capacity of humanity. And that is, each one of us can do better. And it's just a very simple thing, and I'll say it again. Every one of us can do better. So that means, if you just bear with me, that there's potential to do better and to be more effective and to contribute to a more equitable world inside every single one of us. And so, leadership is simply enabling others to be better. Leadership is enabling others to be better. I'm watching different leaders through this really tricky period. And the ones that I really admire the most are the ones who are not interested in pushing themselves up, in getting notoriety, in advertising their organization or their brand or themselves. They're simply focused on just one thing, which is helping others to be better. That's leaders in a household, leaders in the school, leaders in the community, leaders in the hospital, leaders in the workplace. And in fact, it's all of us, because each one of us has the power to lead. And each one of us has the power to help others to be better. And everybody can be better, because that's the capacity of humans. We are constantly learning. So that is part of my sense-making piece. So I'll just go through the list on sense-making. The first is that the lockdowns have given us an incredible opportunity together to be trying to make sense of something new that 6 months ago we just did not have on our radar. It's an extraordinary process of sense-making. Secondly, that our solidarity really does matter. We've never been so connected. We are able to work together. And in my little cameo session with Joseph, just as we were starting, he said to me, I'm an older man. I'm living in the Philippines. I'm a bit on my own. It's great to be connected with others. And I think that that connection, that solidarity is a strength. Thirdly, humanity is ingenious. Humans are capable of so much. And we see signs of this ingenuity everywhere. Fourthly, there are difficult choices to be made, but we can frame our choices so that equity, fairness, justice, sustainability get a much higher emphasis when we make decisions. We have that opportunity now. And I am seeing governments trying, but I'm seeing business leaders making real steps to just frame their decisions differently and not simply just to be after the bottom line. And then fifth, everybody is able to be better, and leadership is about helping others to be better, and your leaders. So thank you very much indeed. Those are my opening remarks on how I see things today, with an effort to try to pull together some of the learning. What we'll do on that, by the way, this was very much raw. We worked on it a bit yesterday, but it had been building up for some weeks, and bam, it came. And so we're now going to produce it in one of our narratives. Those of you who look at our website will see that we have got up to about 20 narratives. Sometimes we call them narratives, sometimes we call them reflections. But we'll try to capture this one, and I'd just like to express extraordinary gratitude to our team. So John Atkinson is our Living Systems leadership guru, who's been working with us in 4SD for now for 2 years, I think. And John has just turned on his video, and I really want to credit John with a lot of the thinking behind some of these ideas, but I will explain that it's also a group effort. Thuy Nguyen, who's also here, she's the one who struggles with, she is Thuy with her background of green. She struggles with the bandwidth at home. Catherine Deland is not able to be with us. She's off working. She's doing some quite important work across the way. Joe Colombano is here, yep. And there's Joe, he's hunkered down in Geneva. He can't come over here to France because of all the restrictions. Joe, thank you for your amazing work on economics and your help with us on thinking through some of the really tricky issues around enabling poorer people to get the assets they need. Magali Mahdi, who's here, yeah, she's part of our team. She's handling all the scheduling challenges. She deals with all the interesting issues we have around doing interviews and so on, and trying to find a way to make sure that we don't get trapped and try to ask impossible questions, answer. Saber Moumen from Tunisia is not here, and Julien Delamontex, who tells me that he's working on masks in the Alps because they've got real challenges with trying to deal with the instruction to wear masks, but then finding people who will produce masks locally has been tricky. And then Florence Lasbender, our managing director, who I'm asking to come and be next to me, who's giving away. We've got people on the call from Canada, Vancouver, Tracy, thank you. From Philippines, Joseph. Nigeria, thank you for coming. Kenya, brilliant. South Africa. Nepal, Rojan, you're here. From Europe, from France, from Switzerland, from the UK. We are very delighted to welcome you all. Tracy in Vancouver tells us that we have outbreaks in 2 poultry packing plants. We are going to find out another surprise about this virus. Why are there such ferocious outbreaks in meat packing plants? I've asked my colleague Bruce Aylward, who I've done a lot of things with in WHO. I sent him a message yesterday, what's going on? We think that actually it's because they're cold. And we think that the people who work in these plants, when they have breaks, they huddle together very, very closely. We think that there is very little physical distancing. So that's hypothesis 1. Hypothesis 2 is that there's something weird going on because this is a place where there are animals. We shall just see. And we're going to ask some of our vet friends working through something we call One Health, which is looking at the interface between human and animal health, to give us some ideas on this. I think talking to union leaders who've been looking at this, they're saying to me, well, David, there's just one thing you need to know. Nobody likes working in a meat packing plant. It's not a job that you do out of love. You do it because you have to do it. And the working conditions are not good. The shifts are long, the place is uncomfortable, and often we sleep in between shifts, and we sleep very, very huddled up close together. It's not good. And I think that we'll come back to that over time, that a big part of the learning about this COVID, when it comes to place, is that actually how we live and how we work is hugely important in determining whether or not we face risk. And if our living and working conditions has us all huddled together, then it makes it super easy for the virus to jump from person to person to person. So whether we're in a ship or whether a dormitory for migrant workers or in a prison or any other residential accommodation, this virus has fun. We suffer. So I think that continuing to focus on the conditions under which humans sleep, under which humans work, and under which they live is going to become more and more important as we learn to cope with this threat and other possible threats like this that will continue to top from animals to humans. You can't stop it. Zoonoses happen. And so it forces us to think very hard about the living conditions that we tolerate and to ask ourselves whether we're going to need new kinds of living conditions, new kinds of working conditions that reduce the threat. And of course, that's obvious, isn't it? But the question is, will the new standards and the new formats be equally applicable for poorer people as well as wealthy people? Or will somehow there be a different standard for poor people, as there is right now, and we'll end up with poor people at much, much greater risk? It gives me a lot of sleeplessness at the moment. So question one, thank you for the questions. How will health organizations learn from the COVID-19 pandemic? Will new protocols be introduced? Will there be research funding and funding geared for the future? It's from somebody called Joe. Thank you very much, Joe. I just want to, this has got such a lot to it, and it gives me an opportunity to reflect on a couple of things. And I see there's a lot of questions, so I must be quick. Now, first of all, you learn if you're prepared to learn. You don't learn if you are not open to learning. So I actually think this is going to be another very exciting challenge, is whether or not health organizations all over the world are going to be ready to learn. If you look at what's been happening in health over the last 50 years, money has gone primarily to hospitals. Hospitals providing acute care, preventive care, and public health, and kind of services for life, like reproductive health, abortion services and the like. They don't get adequately funded. The money tends to go into hospitals. And there are very good reasons for that. That by and large, hospitals get you votes if you're in a political position. But what keeps us safe and ready for threats is public health. And so the question, how will health organizations learn from the pandemic, for me is, will they learn of the need to prioritize health of the whole population, what I call public health? It's kind of what I was brought up on 40 years ago working in South Asia. And I thought, surely everybody's understood that investing adequately in the health of the public, not just in hospitals, is the right thing to do, and to put the priority onto women and children, because unless you invest in women and children, you're not investing in the future. I think that this COVID will wake everybody up to the absolute need for public health and investing properly in public health and doing it right and having good accountability systems so that people can say, I need to be able to show that I've got public health services that work. That matters to me. And I hope that that advocacy around that will grow and that we will get the money spent right and the organizations will learn and will change as a result of their learning. And of course, that means that new protocols have to be introduced. New protocols around infection, new protocols around inequity, new protocols around demonstrating that we can maintain health security and safety through functioning health services. And I think there will be much more investment in health and health research. I just hope that it'll be good investment, that it won't just be investment in new molecules and new treatments. That's important, but it'll also be investment in new ways of leading, new ways of working. because for me, that's the key. If we can't come out of this, learning to lead better, learning to work in a more collaborative way, what an opportunity we have squandered. You know, we have to be able to get it right. And as I keep saying, we have to learn to deal with a health challenge and then use that learning to be able to address the collapse of nature or the massive inequity in our world or climate change. Because humans are better able, humans should be able to deal with this existential series of challenges much better than we're dealing with them right now. We've got the intellectual capacity to do so, we've got the emotional capacity to do so. So we need to be able to learn to do better because we can do better. Number 2, is there more than one strain of COVID-19? Can it continue to develop into more severe strains until a vaccine is readily available? Okay, so here's the situation. All viruses mutate because they're very unstable, tiny little organisms. So small, you can just not see them at all. And there are trillions and trillions and trillions of them all over the place. I mean, they're just huge numbers. And when they're reproducing, yeah, mistakes happen quite often. And usually a virus that mutates just dies, off, gone. However, there are also minor variations in the structure of these viruses, and that happens all the time. And different words used like clade. And what you worry about is that one single mutation will emerge that gives the virus a particularly nasty advantage, like it causes more death, or it more easily transmitted. And that's the anxiety. I would say that this virus, just between you and me, is about as nasty a challenge as we can have. There are other viruses, indeed coronaviruses, that are more lethal. But you know, that's actually an advantage because they tend to die away quickly. A virus that kills a lot of people isn't very good at reproducing itself. A virus that doesn't kill many people is amazingly good at reproducing itself. And so there are certainly multiple different strains of COVID. The question is, do they actually have different capacities to cause disease? We don't think so. So far, there is no scientific evidence that suggests that there are more than one distinct strain of the virus with different degrees of severity. That's telling you what I understand from the literature now. I wouldn't be surprised if it does perhaps go on changing. I think that in designing the vaccine, there will be an effort made to link the vaccine to the part of the virus that is very unlikely to change, which is the part that sticks on to the cells inside the human body. Now, they're a kind of a probe that goes into the receptor in the epithelial tissue of the lung. Question 3. Do you see any chance of antigenic shift in the coronavirus with other viruses circulating? Rojan, thank you. I do not at the moment see that happening, but we have always been concerned that viruses are capable of combining with each other and shifting and mutating in that way, but so far I've not seen it. Question 4, I think we really need to focus research on how to cope with the virus since we can't be in lockdown. Totally agreed. I don't want us to stay in lockdown forever, ever at all. I want everybody to be able to release their lockdowns, but at the same time, I want to be sure that they've put in place what I call the build up or reinforcement of public health services. So it goes like this. You reinforce public health services so that you can find people with the disease and isolate them. And then you release your lockdown, knowing that if you get more cases coming because the virus is still circulating, you can suppress outbreaks quickly. And that is what is happening. The lockdowns are being released, but at the same time, basic public health services are being strengthened. And in many, many countries, that process of strengthening the community-based public health services is underway at speed, and that will make it much safer to release lockdown. I do not believe that lockdowns should go on and on. A lockdown itself does not stop spread of disease, it's interrupting transmission. And here we get it, yes, you see, it's so hard to be strong in keeping lockdown measures, question 5, that save lives when taking away livelihoods and crashing an already broken economy just doesn't work. I so agree with you. You know, you can release a lockdown, and you should release a lockdown. And you should do it quickly because it hurts people's economies, it hurts their livelihoods. But you've got to make sure your public health defences are working. I think that many governments are actually quite scared that if they release the lockdown and the upsurge in cases happen, that it'll really upset people, and it will. But I think you have to level with the people that we expect there to be a small upsurge, but what matters is that all communities everywhere are able to defend themselves against the arrival of the virus. All communities everywhere know that sometimes they have to close down and stop movement. Sorry, Marianne, I thought I saw your hand up. That if I did, you will unmute your mic and tell me. So we've got to find a balance, says this questioner. Jane, as restriction measures have been fought against by the masses. I agree, Jane. And, you know, I just think that everybody has to be clear that the restriction measures just are there to buy you time, to enable you to build up your public health defences in the community. Jane, where are you? There you are. I'm just going to ask you, just give us just a couple of minutes on what you're seeing, because I think you're in South Africa and you're seeing things to be quite tricky right now. Jane, you are.
Yes, hello, David. Can you hear me?
Yes, perfect.
Yes, I think this is really the difficulty because South Africa, I think, wisely locked down early in order to do exactly what you said, buy time to try and get PPEs, get testing equipment. But as a result of that, it means we're doing really well, relatively, of course, in terms of our figures with, I think this morning, just over 8,000 cases and just over 150 deaths. So people are saying, but why, you know, look how few are dying. We're getting all those comparisons to HIV, TB, and saying, so why are we locking down where we're seeing devastation? Pictures yesterday of people with absolutely no social distancing queuing for food parcels.
Yeah.
So I think the devastating consequences, though, have highlighted, and you touched on this, David, the incredible inequities in our society here in South Africa.
Yeah.
And so I'm truly praying that this terrible virus will lead to a new everything. We need right now, yes, political unity in a country and global solidarity, but at some point, a country like South Africa is also going to have to restructure everything. Its political system, its social justice system, its economic system, its societal system, and it has to do all that with a crashed below junk status situation. And that really is the challenge that keeps me awake at night.
Thank you, Jane. As you just said, the structural changes have to happen, but there's no money. The country, as you pointed out in your question, the country is bankrupt, and it's not just in South Africa, it's in many other countries as well. Yeah, and it keeps me awake too. Thank you, Jane. Nice to be connected again. Question 6. While there's global cooperation among scientists on leadership, what can be done to include the cooperation on, for example, sharing a vaccine when it becomes available? Marianne, thank you for that question. One of the good things that's happened over the last few days is that there was a quite massive pledging conference organised by the European Union on vaccines, therapeutics and diagnostics. And the one excellent agreement that comes out of that is that the countries that participated in that agreed that they are going to focus on ensuring equity of access, especially when the vaccine becomes available. I suppose my only concern, this is one that we all have to work on, is that not every country who really ought to have been at that pledging discussion on vaccines, therapeutics and diagnostics, not every country who should have been there was there. And so I think that over the next few weeks, people like myself are just going to have to keep on and on focusing on the importance of equity, just as we just need to make sure that countries like South Africa are able to access some of the cash that is coming for helping to reduce bankruptcy and reduce poverty. So we also need to be sure that all countries can access vaccines and diagnostics and treatments when they become available. This is something that's inside a resolution that's being discussed for the World Health Assembly right now, that will be then considered by the World Health Assembly members on the 18th of May. So thank you, Marianne. I've followed that up, and please keep on my tail, poking me, saying, what are you doing about that one? Question 7, curious to know what you feel about the One Health movement. Could it gain more of a foothold? Time has come for a more collaborative systems change across animals, nature, and people. Totally agreed. The One Health movement is the only way forward. It is a universal approach to health, whether you're focusing on animal health, human health, environmental health. And it emerged in 2004, 2005, and it needs to be there strongly. Thank you very much indeed, Karen, for making that point. Up early, striving to be better. Well, we can all be better, and you are great. Question 8. We truly hope that we will see our model of leadership going two-way in institutions. I'm seeing a lot of blaming of top managers. How can we overcome this? I totally agree, Imam. A lot of the people who are attacking the managers at the top and criticizing them themselves would not be able to do the management function. They just kind of just taking pot shots and saying, looking at things from very single perspectives. The kind of leadership that I'm talking about, Imam, is leadership that is multi-perspective, where you look at life through the perspectives of lots of different people, and you actually understand some of the factors they had to weigh out when making their decisions, and you get in alongside them and work with them, perhaps to do some of the reframing that I talked about. This form of leadership is something that we can actually share. I mean, it's what we spend our time helping people to learn here in 4SD. So if you ever find people who say, we'd like to know more about what we call living systems leadership, that's a collaborative form of leadership that helps people to be better, just stay in touch. Get in touch with us on contact@4sd.info. We would love to work with you, Iman, on this. And then question 9, we need a sustainability plan to stop the spread of virus, especially in developing countries. How will we do this when the rural areas of developing countries are at higher risk due to lack of accessible clean water and lower level of awareness? Well, Chinazo, thank you for this. It's again showing us that the way in which we accept massive inequities in our world makes us vulnerable to the impact of a virus like this. And the only way we will be strong in the face of these kinds of threats is if we can deal with the inequities. Inequities are not only cruel, they make us weak in the face of adversity. It's so abundantly clear, I think, to more and more people now. So, Chinazo, it's a time for us to really call leaders to account and say, you want us to be strong in the face of these threats? Then make sure that we've got the connectivity, make sure we've got the access, make sure we've got the opportunity. Then we can join the rest of you and be strong. But keep us in a 2 or 3 or 4 tier society and deny us of our rights and our opportunities. We can't join you in this battle. We're just too busy trying to ensure our own survival. So this was an effort today to talk about learning. And it's really a stock take on our learning up till now. And now I just want to thank you. I've just been passed a note. I wanted to check. We've got 28 people on the call today. And each one of you in your different places where you work all over the world, each one of you is a leader. You don't have to be a boss to be a leader. You don't have to be rich to be a leader. You don't have to be old to be a leader. And you certainly don't have to be a man to be a leader. You can be a leader whoever you are. And I want to go one step further. You are a leader. Let's go back to those words. Every one of us as humans can be better. It's just a reality. We've got these amazing brains linked to our hearts, linked to our souls. That's where our power comes from. Connection between the reasoning instrument up here and our emotional and sensing beings that are elsewhere. And that gives us incredible capacity to be better. And you, as leaders, whoever you are, you're just here to do one thing, and that's to help others to be better. You are enablers, you're facilitators, you're supporters. You're not out there to take credit for anything. Best leadership is done invisibly. Best leadership is not really perceived. It's there in the background. But that's the real leadership. With love to everybody, thank you very, very much indeed. As I said, it's number 14, I think. I lost count, and it was a bit of an experiment. It was a stock take of where we stand. It wasn't so much me pushing out invocations to you. It was more trying to be reflective. Thanks to Joseph for the comments at the beginning. Thanks so much to Jane, who's connecting after a long time, for telling us a bit how raw it is in her place where she is. And thanks to everybody, those of you who got up early, stayed late, particularly the people on the west coast of Canada and the US. So, so good to be connected to you. Stay solid and together. We'll come out of it a better humanity, I'm convinced. Bye-bye. To my daughter, are you there? Just want to see whether you're there. I saw you just now. Sarah, are you there? Are you alive, Sarah? You look like you're outside. Sarah Phillips, looks like you're outside somewhere.
Yes, I am. Hello. I'm just in Nottingham. There's the Trent there, you know, the cricket.
Oh, yes. Very nice.
Yeah, and the football.
Wow. Hey, I saw some of your stuff on LinkedIn, Sarah. Really interesting what you're doing. It's great.
Well, I'm trying to share what I'm learning, which is a lot, but not overstep the mark and make sure it's useful and doesn't cause any damage.
Yeah.
But I'm finding that if I'm discussing things with people, it is helping them. So it seems to be working. So thank you very much. Thank you.
Remember this point that it's about sense making. So everybody is having to make sense at the same time, including my grandson Isaac Fawcett, who is with his mum.
Where is he?
He's there. There he is. There he is. At the kitchen table. Brilliant. That's John waving to you, Isaac. Nice to see you. Have a good day. Marianne, thank you very much indeed. And Folkestone, you look great. Oh, that's my boy. Brilliant. Thank you all. And John and Tui, thank you. And everybody, I'm going to tune out now, but it's been great. Bye.